substance use disorder. I recently visited Cottonwood Springs to speak with Dr. Molly Bullard about treatments available here locally. So how do you determine a level of care for somebody who is chemically dependent?
Well, if a person is in need of treatment for a substance use disorder, they're going to come in for an evaluation, and that's going to be done by a trained mental health clinician. And so what they will essentially do is ask the person a lot of questions about their substance use, like how it's affecting their life and what problems it's incurring. And then we take all of that information and we make a treatment plan, is what we use to figure out what the level of care should be. And essentially what we mean by that is just what type of treatment, how long will they benefit in treatment, and in what kind of setting should they be in. So
let's talk a little bit about a couple of things you hear when you talk about treatment: medical detoxification, and then extended stay and that kind of thing. Does this all kind of wrap around together there?
It does. So medical detoxification is often the first step in treatment. It's when a person is monitored 24/7 to safely withdraw off the substance, and oftentimes they will have additional rehabilitation benefits if they need to have longer stays in treatment.
Right.
Medical detoxification is usually 3 to 5 days. Sometimes it can be longer if there's other medical issues. And medical detox doesn't really address the long-term patterns of substance use, so we recommend additional treatment because that's what's really going to help them get to understand the underlying issues that's causing the substance use in the first place.
So do you find that insurance companies cover this treatment, and how do you know what's covered and what isn't? That's a serious question for patients.
That is. That's a very common question. I think it's hard to answer, but the best way is just to say that it depends, because it really depends on the insurance company and their particular plan and what the patient's needs are. And most insurance companies will cover medical detoxification if it's for a substance that they really need to safely withdraw from, like if it's alcohol and they're drinking that much. Others might approve for benefits for rehabilitation, especially if there's medical complications. And then when it comes to the other levels of care, like outpatient treatment or residential, it really just depends. And I would say that for us as providers and our patients that we work with, that's one of our challenges, is when we're in a situation we have a patient who we're saying we really think they need longer term treatment, that's really what's going to make them heal, and they may not have that benefit. So it's a really challenge to figure out how to help that patient when they need to stay in treatment longer.
Exactly. So is there a fear on the part of people that they might lose their job? You know, if they have a problem, they need help? And I see a little acronym EAP oftentimes in this discussion. What is that all about?
So EAP stands for Employee Assistance Program, and that is when a person has a program that allows them to deal with issues they're having at work, from personal issues to mental health issues. The employer will provide treatment, whether it's a few counseling sessions and sometimes a mental health program or even a substance use disorder program. So for example, if a person was drinking and it started to get in the way of their work and they get recommended to go to treatment, they can complete treatment as long as they're successful and show that they haven't been drinking. Their employer will take them back to work.
So you shouldn't let that fear keep you from seeking help. We've got less than 30 seconds left. What role do loved ones play in this? How does that come into it?
I think having family involved in treatment is absolutely critical. We think of family or addiction as a family disease. Family really plays a role because they need to be educated as well about how a substance use disorder affects the person's life, what they need to go through for treatment, and even the longer term steps, like how do they support their loved one as they leave treatment and come home and try to adjust back to their life.
Excellent. Thank you so much.
Thank you.
Now, for more information, you can visit 13351 South Arapahoe Drive in Olathe, or you can give them a call, 913-353-3000. Go online to cottonwoodsprings.com.